did an open community forum. Brian asked us to find a rock star in the community that would engage the community at large. We had a great breakfast gathering. And Aneesh kind of has a formula. He's the author of a book which I recommend to you called The Innovative State. You have to pay me for that. My royalties as usual. Thank you.
It's a barn burner. It's ripping off shelves.
But inside, in that is essentially a playbook. And the playbook, first of all, is not to try to give you the synopsis of the book in detail, but really weaves the history of public sector innovation and how, in fact, it not only happens in public sector, but how, in fact, when done right, bleeds over to and actually gets absorbed into the private sector and the private economy, bringing value both to the public and to the private. Going forward in the digital age, this is the man who actually, during his tenure in the Obama administration, really helped to guide the strategy for the innovative American agenda for the 21st century that President Obama asked him to lead, and was critical, seminal in actually architecting work that includes working with his colleague Vivek Kundra on opening data.gov, working significantly in committing the country as a whole to think through digital infrastructure, really propelled cloud services in the public sector, not by writing a directive, but actually getting the federal agencies to actually force them to work together through his leadership in the Office of Science and Technology Policy. Again, in inviting all these folks, we sent a much longer, detailed celebration of your past during the Obama administration, but also giving folks a sense of your work at NavHealth and the work that you continue to lead, especially around healthcare and education in the country. So I'm just going to ask Aneesh to very briefly speak to essentially the 5 key elements in the playbook, the summary version of them, because we want to actually, again, over the second half that we have with you, to actually work together with you on trying to sort through probable scenarios where we could actually initiate projects. And Aneesh was just riffing in real time, and we got 2 or 3 projects going just out of the last session. And I have no doubt that if we share some of the things that we're thinking about, he's going to have some great ideas. So Aneesh, why don't you start?
Thank you, Lev. And I'm going to use the opportunity to do the playbook around the infant mortality topic, so it starts with a more tangible scenario. But the problem that I envision solving is connecting good, spirited people who have ideas to solve problems to the institutions in the public and the nonprofit sector, so that it's easier to collaborate. There should be less friction in working together. And so with that spirit, let's take the playbook in context for how we thought about infant mortality. Virginia, where I was Virginia's technology secretary, had among the worst infant mortality rates in the country, despite being one of the wealthiest states in the country. So the governor said, how will you dig into this? So the first idea is understanding our digital infrastructure. And in the context of infant mortality, it was the notion of telemedicine. We have much fewer high-risk OBGYNs distributed in the urban centers and not so much in the rural centers. And a lot of our high-risk OB needs, obviously many were in the inner city, but also in rural. So point number 1 on digital infrastructure, we had to find a way to make it easier to connect, in this case, federally qualified health centers in rural parts of the state with the academic centers, number 1. Second, we needed standards that would allow organizations to share information across boundaries. We didn't have them when I did the project, but I'm going to share it as an example now. A mother in pregnancy is seeing a pediatrician or OBGYN, and they have medical records. They might need a consult from a high-risk OB, or they might want to go to a facility that's sort of an academic or a hospital. Those two don't talk to each other. We've tried for a decade to get them to talk to each other. There's now an emerging standard that would allow the mother to push a button to connect the OBGYN with the hospital and have that information flow. So standards are the second idea. We've got to do more to convene the development of and the use of standards.
If you don't mind, digital infrastructure standards.
That's two.
Digital infrastructure. Cataloging the playbook.
Yeah. The third one, from my vantage point, is to make open data the default. So we had lots of statistics in the health department on infant mortality. CDC does surveys. There's all this stuff, and we tell people to download a report or read some article or hear some testimony. So we now said, let's make all of the raw data accessible so people can be kind of common language on zip code based infant mortality rates, other scenarios. So our thesis is if it's held by the government, it should be public and machine readable by default. That's the third. Data held by the government shall be open and machine readable by default. And the machine readable part is humans can't read every report and look at every data set. You might want to train a machine to go look for the stuff to tell you something useful. Okay. Then the fourth one for us, this is where it's a little spicier. The notion of retail and wholesale services, digital services. Let me draw the analogy on infant mortality. So, it's not going to be a direct analogy, but it's as close as I can get. We launched something in the White House called Text for Baby. Are you familiar with Text for Baby? Public-private partnership, Johnson & Johnson backed it, foundation, whatever. And basically a startup that was serving Africa, finding ways to deliver messages around HIV/AIDS, said, hey, we could do something like contextually relevant text messages. So the idea was, if the mother entered the due date and the word baby or bebe in Spanish, then the Text for Baby system would send 3 relevant messages a week. Some generic, like eat healthy, whatever. Others like, hey, you're due for a prenatal visit, did you schedule it? And we had our Medicaid systems distribute information about this app. Here's the point. If you're in charge of infant mortality and the mother is on the Text for Baby app, how does the OBGYN know that the messages were sent and if there was any response to it? There's no feedback loop. If Text for Baby was both a retail service, which it is, but also a wholesaler, so the OBGYN could incorporate that experience, then they would have a more holistic view and be able to link multiple services, right? Then you can start testing intervention A versus B without having people to go. I mean, it's this guy's problem of every doctor logging into 15 different portals to figure out what's wrong with their patients. He's like, hey, stitch all that stuff together, I'll give you insights. Well, not everyone has a $1 IT thing to do that. So the theory was, my fourth point is making sure that the data is accessible in wholesale and retail, so you can combine and remix and reuse. And then our last one really is where we fell short in Virginia, and that is the financial incentives. So I'm not going to name names, but the academic center said every avoidable prenatal birth that results in a NICU visit is massively profitable to academic center X. Okay? And so what we did in our program was we found the zip code of basically migrant farm workers in the Shenandoah Valley had the highest rate of preterm birth, nearing 15% in Harrisonburg. And they were about an hour and a half from an academic center that had access to high-risk OB. There was no high-risk OB anywhere for like 50 miles. So we funded an initiative using telemedicine. They could go to the federally qualified health center, have a consult with the high-risk OB, and we monitored that over time. We cut preterm birth rates by 25%. And the bad news is the program didn't scale because once the grant funding ran out, no one paid for that. That's not a reimbursable code or whatever the hell it is. And so basically, I was arguing, let's bundle the costs with the neonatal visits, and we use the savings from the unnecessary neonatal to do this. And the CFO of the academic center was like, kind of the profit center of the hospital, blah, 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 so it didn't really go anywhere. But those are the 5 principles. If we got the last one, which is reward outcomes, not just fee for service, we could actually massively scale great ideas. In this case, we would have cut the Medicaid expenditures untold millions and would have made people's lives better and all the rest. So kind of annoying, maybe mad, whatever. But we got to fix that.
All right, so the playbook, again, I've got sort of a sheet for each one, and we're going to go into it in a moment. But I just want to make sure that folks have a chance to ask some questions before we kind of try to do a little bit of a roll up our sleeves activity. So if you've heard them again, digital infrastructure, if you've got questions, feedback, thoughts about it, let's kind of share it in the open. Second piece has around standards, and the third piece is essentially open by default. The fourth piece in this is wholesale plus retail, and the fifth piece of this is creating financial incentives to improve outcomes and hopefully reduce costs.